Good evening, everyone. This is Muhammad Bilal, physiotherapist working in Somalia. The topic today we are going to discuss in regard to the physiotherapy is Russian current. It is the electrotherapeutic modalities which we used in our physiotherapy department for various clinical conditions. So we go through these conditions, the protocol, and the other things which we used during the therapeutic applications. So before that, we go through a little introduction about Russian current. This was discovered by a Russian scientist, so it is named as a Russian current, name Yakov Knots in 1977. He first applied this Russian current for a Olympic sports athlete. For a muscle strengthening and for a muscle re-education. So this is a small introduction about the Russian current. So in the electrotherapeutic modalities, there are three types of a current we are use: low, medium, high frequency current. So low frequency current is from 0 to 100 hertz. Medium frequency current is from 1000 to 10,000 hertz. The high frequency current is above 10,000 hertz is come under these categories hierarchically. So low, medium and high frequency current. What are all the low frequency current modalities which you are using? Stimulator or a muscle stimulator and TENS. The medium frequency current which we are using is NEMS or Russian current, and interferential therapy or this is the come under the medium frequency current. The high frequency current are short wave diathermy. These are all the examples, some of the examples which we are using for which we are categorized under the medium of frequency. So this Russian current come under a medium frequency current. So we don't see about the other things here. So the Russian current is come under the medium frequency current, which has a frequency range between 1000 to 10,000. It has a certain characteristics like carrier frequency is a basic carrier frequency of between this range is 2000 500 hertz. This is the basic carrier frequency of a Russian current with a basic burst frequency range of 50 hertz. This has been applied to the patient with a duty cycle of vary according to the condition. It has a duty cycle maybe in a ratio of 1:1 or 1:2 or 1:5, like this the ratio will be vary. So these are all some of the characteristics of the Russian current. So it has a basic carrier frequency. When you see the modality equipments, it has a basic carrier frequency of 2500 hertz with a burst frequency of 50 hertz. The duty cycle is nothing but the on and off time of the burst frequency, the time where the current goes to the patient, the time where the current is off. So this ratio will be vary, depends on the clinical condition. As we discussed earlier, it's a medium frequency sinusoidal current. Okay, so it has both a sine wave and a cos wave, sine wave and cos wave, applied in a burst or modulated or applied. Burst mode, which means this is called as a duty cycle burst on time followed by a interburst interval, again followed by the burst on time. So in this burst on time, the burst frequency of either what we choose as 35, 50 or 70 hertz, which we are choosing, has been applied to the patient. So it has a basic carrier frequency of 2500 hertz, which we already discussed, with a burst frequency of basically 50 hertz is the minimum range. Below that also we can use, or above the range also we can use, based on the clinical condition which we discussed later in this video. With a burst on time or the duty cycle period, burst on and burst of time, maybe for some condition we can use 5 second on, 5 second off. For some other condition we can use 10 second on, 50 second off. So this may vary according to the clinical condition. So as we discussed earlier, it's a medium frequency sinusoidal current. It has no polarity effect on the patient, so that it is very comfortable and the depth of penetration is also very deeper. The current depth of penetration is very deeper. As a medium frequency current, it's very comfortable and depth of penetration will also be deeper, go deep into the muscle, and it's a sinusoidal current with a burst on time and interburst interval, which is a burst off time. So some of the settings which we use, which we seen is basic carrier frequency and burst frequency, burst on time, burst off time. Another setting which we mostly seen in the some of the modern equipments or some of the old equipments when we are in a college time is ramp setting. Ramp on, ramp up and ramp down. This is nothing but to avoid a muscle fatigueness and muscle discomfort. This settings has been used up in some machine on the display itself, or some machine it is pre-modulated, which means already it has been set up inside the machine based on the research or based on a some called as a we call as a based on the basic protocol. This ramp up and ramp down time will be already preset or preset inside the machine itself. So in order to avoid the muscle fatigue and muscle discomfort, this ramp up and ramp down is necessary. It's nothing but the slow rise in the current followed by the burst on time and slow fall in the current. So this is the ramp up. Slowly the current, the burst frequency has been raised and in a range of plateau, again slowly it is down, followed by the interburst interval. So this is burst on time, burst of time. Okay, again followed by the ramp up and a plateau and followed by the ramp down. Ramp up, plateau of the current and ramp down. So this is called as a ramp up, ramp down, ramp up and ramp down. This is the burst time where we apply the burst frequency of either 35, 50 or 70 Hertz, which will be vary based on the clinical condition or based on the muscle size. We can reduce the burst frequency or increases the burst frequency for a clinical outcome to get out. Here we go through some of the slides which I prepared for you. So Russian current was developed and discovered by Yakovanots in 1977. It's a medium frequency current, sinusoidal current with a carrier frequency range of 2500 Hz, modulated or applied in a burst mode. So it has a parameter with a carrier frequency of between the 1000 to 10,000 Hz. It has a carrier frequency of 2500 Hz with a burst frequency of 50 Hz that is delivered during the burst on time, and the duty cycle that may be vary based on the condition with the ramp up and ramp down time. During the initial period, this Ecobonots has used a basic treatment regime of 10, 50, 10, which means 10 seconds on time, 50 seconds off time for a period of 10 minutes. So This protocol has been applied to the patient for a time period of 3 to 4 months. During application each day, we have to use this application along with the voluntary muscle action. Which means we have to place the electrode on the patient in case of if we apply for a quadriceps, we ask the patient to do the activity for knee extension during the burst on time when the patient feel the current into knee extension, and during burst of time we should make the patient to relaxation. So this will recruit more number of motor fibers inside the quadriceps muscle when we combine along with the voluntary muscle action. So this is the basic treatment regime in a ratio of 10, 50, 10. 10 seconds for on, 50 seconds for off for a period of 10 minutes. Sometimes we can use it for a 15 to 20 minutes. This may change according to the clinical condition or the outcome we needed for a period of 3 to 4 months along with the combined with the voluntary contraction or the voluntary muscle action. So during the slides, so as we discussed already, it has been applied along with the muscle activity. So this is the graph for the Russian current. This is the burst on time and the burst off time with the interburst interval. This is the burst on and burst on with the interburst interval or the burst off time. As we discussed, these are all the characteristics of a Russian current with a carrier frequency of 2500 Hz. Wave, as we already discussed, is a sinusoidal wave with a current amplitude, which means the intensity which we are going to increase for the patient maximum up to 1000 milliamp we can use. With the clinically we can use for 70 milliamp is fair enough for a better outcome. With a burst frequency of 50 Hz, this may get decreased or increased based on the clinical condition or the muscle we are going to choose, and the burst duration on and off cycle or the duty cycle with a setting of ramp. So here is the ramp up time and on time, again for a ramp down time with the off time. This ramp up and ramp down will help to avoid the muscle fatigue and muscle adaptation. So slow increase in the current intensity followed by the on time, followed by the slow decrease in the intensity of the current. This will looks like a or a copycat like a voluntary muscle contraction. So when apply the Russian current, we have to combine with the voluntary muscle action also, doing the any activity of the muscles we are going to choose. In case of biceps, we have to allow the patient to do the biceps, the available biceps movement or the available biceps action in flexion, extension, like that. As we discussed, it's a medium frequency current with a frequency range between 1000 to 10,000 Hertz. And this current is therapeutically used with basic advantage of its depth of penetration is much deeper and it is highly tolerable and comfortable for the patient. What is the physiological effect? The physiological effect is when we apply the burst frequency based on the muscle we choose with 20 for a small muscles, 50 for a medium muscles, and 80 or 70 to 80 for a big muscles like glutes or hamstring, or for biceps, or for thinner muscles. This may be differ. So it will cause us the muscle or the motor nerve recruitment. It will cause us the motor nerve recruitment. This will helpful for a motor muscle depolarization. Which may leads to muscle to contract. So when combined with the voluntary muscle action, it will help to improve the re-education purpose and increase the muscle strength. So this is the physiological effect, and this is the clinical outcome we need, or the therapeutic effect we required. So this is the major help of the Russian current, why we use it. So because of the muscle contraction, on behalf of the physiological effect, the muscle will get contract. As the stimulation will lead to muscle depolarization, may lead to muscle to contract, which causes the increase of blood circulation. So this will reduce the edema and promote the healing of the muscle. So what are all the clinical conditions we are using this Russian current? Indication and contraindication. Indication mostly we use for a post-surgical knee condition like arthroscopic knee surgeries, ACL reconstruction, total knee replacement condition, where due to arthrogenic muscle inhibition, the quadriceps muscles arthrogenic muscle inhibition, which we see in the latter in this slide, the quadriceps muscle, especially the vastus medialis obliquus, will go for a atrophy. So this Russian current will help to recover this atrophy. Other post-surgical condition like ankle sprain, which may causes the edema, where we use the edema protocol, which also we are going to discuss now, and other conditions like a muscle spasm, as it causes the muscle to contract. This may increases the blood circulation and promote healing and reduce the spasm. Contraindication, as we discussed, it causes the muscle to contract and the depth of penetration is much deeper. We should avoid for the patient with peripheral vascular disorder patient and a patient with thrombosis and the patient for neoplastic condition or tumor patient or sensory disturbance patient. We should need to avoid and over the metallic implants and over the cardiac pacemakers and over the DBS patient, deep brain stimulation patient, where there is a pacemaker over the right side of the heart or the right side of the pex muscle and near the area of heart. So these are all the indications and contraindications. Indications may be post-knee surgical condition like arthroscopic ACL rehabilitation patient, total knee replacement. In this patient, if the orthopedician or the physician does not refer for early physiotherapy, it may cause us the arthrogenic muscle inhibition, which is nothing but a atrophy of a muscle, which is a normal neural phenomena, which is commonly present in our body, which may cause us to further damage. To avoid the further damage, the muscle will stop the movement. This may lead to atrophy and the ankle sprain and for muscle spasm condition, and even for the casting patient like POP casting patient. You can use for the distal region on the proximal region of the muscle when leaving the casting area. And the contraindication, as we discussed, this Russian current will causes the muscle contraction and the depth of penetration is also very deeper. So we should not use for the peripheral vascular disorder patient and thrombosis patient. Why? Because the thrombus became embolus and it may reach the heart, lung, or in case of a brain, that may cause us a stroke, heart attack, or even the pulmonary dysfunctions. And neoplastic tumor, as it may causes the spreading of the neoplasm to other area, sensory disturbed area, to avoid the electrical burns. The patient will not aware of the intensity, so we may sometimes increases the intensity for the maximum sensation to get. This may cause sometimes the electrical burns over the metallic implants, as it has a deeper depth of penetration near the cardiac, DBS, and over the heart. Now we go through the protocols. So, as we discussed earlier, it has a parameter of carrier frequency 2500 Hz. This is constant with a burst frequency of 0 to 100. Condition may vary. The frequency may vary depends on the clinical condition. Mostly in my clinical setup, I mostly prefer for this one and the 50 Hz and 75 Hz. Where I use the 35 Hz of burst frequency means in case of edema or smaller muscles to stimulate, I choose for a 0 to 35 Hz for a smaller muscles like thenar or elbow muscles like elbow flexors. This 50 to 75 range, maximum up to 80, we can use for a big muscles like a gluteus maximus, vastus or the quadriceps in generally, or in case of a muscle re-education. For a stroke patient, we use in our clinical setup for the muscle re-education for the stroke patient. What the clinical outcome we got is there will be the improvement in the gait pattern. The patient initially came and not aware of walking. Post the stimulation with the pressure current for a period of 10 to 15 days, the patient tried to are aware of their legs and try to initiate the walking with the dependent only, and slowly they may shift to the independent walking. We see many cases that too depends on the degree of the brain damage and when the patient will reach the physiotherapy department for re-education purposes. So this outcome will be vary on this condition which I told, or that this the time it reaches the physiotherapy department, the patient reaches the department of physiotherapy for re-education purposes. Because in our department or in our country, most of the patient will come in a very late stage. So for those patients, we try to maximum to gain at least the gait pattern to improve. Regarding the hand condition, to improve the hand function, for some patient we get a early recovery. For some patient we are still waiting for the recoveries. So these are all the burst frequency range and the condition for which we are using, mostly for edema and for the big muscle stimulation and for the muscle re-education we use these two frequencies. With the burst on time and burst of time protocol. So burst on time for edema, it will be 2 to 5 seconds. For strengthening or re-education, it will be 10 to 15 seconds. And the off time for a edema reduction is it will be like a same 2 to 5 seconds, and strengthening and reduction or re-education it will be 50 seconds of time. So this is the protocol which we used for the clinical conditions. So this is the indication and this is the contraindication. And during the pregnancy also we should avoid. And the Russian current for the trigger point. Trigger point is nothing but a hyperirritable taut band. When we find the trigger points, if we place the electrode directly over the taut bands, mostly we can place the positive over the taut area and negative for some other places. It will causes the muscle to get contract and relax. So it will causes the blood circulation, improve the blood circulation, and this will help to elevate the pain. The blood which circulate for this region will elevate the pain substances, reduce the muscle tension, hence the pain has been reduced. For the trigger point condition, we have a carrier frequency of 2500 Hz with a burst frequency of 50 Hz, and burst on time, burst of time will be for a 10 seconds on and 10 seconds off. This is the burst ratio, 1:1 ratio. Ramp is mostly we can't see in some machines because as it is pre-modulated, so I won't discuss about that, but I inform what is the purpose of the ramp, as it is helps to improve the or increase the stimulation like a voluntary contraction followed by the burst on time and followed by the decrease in the voluntary muscle contraction and then followed by the interburst interval or the burst of time. So that this is a purpose for the setting ramp. With the pulse duration, some machine has a pulse duration. Maximum we can set 200 microsecond to 300 microsecond. This we can see in some machines, and some machines we can't see this one. This is for the trigger point. In case of edema, suppose if you have the edema in the ankle, we have to place the negative electrode over the edema region on the positive electrode something distal to the edema region, as the edema contains the negative charges, or the water it contains mostly the negative charges, so it will cause us placing the negative electrode will cause us the repulsion of the negative charges and it has been flowed towards a positive charge. If we place the parts we are going to teach in a somehow high position, this will help to automatically, along with the gravity plus Russian current, will help to assist in the edema reduction. So as we discussed earlier, the burst frequency will be 35 is comfortable for the edema reduction, with the on and off time will be 5 seconds in 1:1 ratio. So the Russian current with a burst frequency of 50 Hz allow for rhythmical muscle contraction of the fibers. This will release the muscle tension and improve the circulation, thereby alleviating the pain. So this is the arthrogenic muscle inhibition, which may causes the muscle atrophy to avoid the further damage post knee surgical or any injury. So to avoid a further damage, it will inhibit the muscle action. This will cause the muscle to get atrophy or deconditioning. Once there is a deconditioning, it will cause the impairment in the knee function or the muscle action or the joint action. Like knee, in case of knee, it will cause us impaired knee extension. Gait instability, which may include static and dynamic instability, and increased risk for early OA. This is because of muscle atrophy. We may get the imbalance and we may put more pressure on the inhibited legs. This may cause us the compression of meniscus and early degeneration may get started. This will also impede the treatment, impede the progression of the treatment. So we have to find out the underlying cause for this inhibition, and we should need to facilitate the muscle activation is much necessary. Now we are going to see about so this is the protocol method which we are using, and the pulse duration for the muscle strengthening will be 150 to 200 microsecond. For muscle spasm, we use 50 to 175 microsecond. For edema reduction, you can use a 400 microsecond. So this is how we have placed the electrode along with the voluntary muscle contraction for a quadriceps atrophy. And in case of edema reduction, you can place the electrode like a minus or the negative electrode or the cathode over the edema region and the anode over the distal, somehow the proximal or somehow distal to the place. Since the fluid in the edema is mostly contains negative ions, so we have to place the negative electrode over the edema region. Or in case of gastrocnemius, if we using the 4-channel, we can use the 2-channel or for the medial head and 2-channel for the lateral head, the gastrocnemius muscle for the muscle pumping action. This is how we have to place the electrode. So thank you everyone for watching this video, and kindly share with another physiotherapist or the students. Hope this video may help for better understanding. To my level, I explain this topic. In another video, we will discuss about the interferential therapy and the TENS protocol, where to place the electrode. or acute and chronic conditions. We are going to discuss in a soon on another video. Thanks. Please subscribe to this channel and share with many physiotherapy students for their benefits.